Hello, friends. Welcome back. Today, we are going to talk about the history taking station of the MRCS. There are two history taking stations in the communication skill scenario, and these history taking stations are very scoring. If you know the differential diagnosis, if you know the questions to be asked for each differential diagnosis, then you can easily score a very high marks in the history taking stations. Today, we are going to discuss an example of the history taking station, and you're going to understand how we proceed in the history taking scenario. So let us start with our scenario. So here we can see there is a candidate instruction for me. I'm the candidate here. I'm standing outside the station. There is an instruction for me and I'm being given 1 minute time to read this instruction. So I'm going to read this instruction. While I'm reading this instruction loud, like a 70-year gentleman has presented to your clinic complaining of difficulty in swallowing since last 6 months. Considering the history taking station, you are asked to take a history from the patient to help him with the diagnosis. So my patient has difficulty in swallowing. At this time, when I'm standing outside, I have 1 minute time to think about the differential diagnosis and the relevant questions. That's where the importance of practice comes. Now, this is the time when I'm recalling about the differential diagnosis. By the end of 1 minute, I will step inside and I'll start asking questions to my patient. So I'll wait for 1 minute to complete. Now, as soon as the bell rings, I will enter inside and then I'll get 6 minute time to talk to my patient. Okay. Hello, I am Dr. Ankit Goel, one of the surgical candidates for this exam. May I ask your name and age, please?
Hi, my name is Mark Phillip and I'm 70 years old.
Hello, Mr. Mark. I'm going to ask you a few questions about the problem that you have come here with. Is that all right?
Yeah, sure, please go ahead.
So please tell me what brought you to the clinic today.
Doctor, I'm unable to swallow my food properly. I'm in lot of trouble. Please help me.
I'm sorry to hear that. We'll definitely find out what is going wrong with you. I'm going to ask you a few questions related to that. And could you please tell me for how long are you having this problem?
I'm having this problem for around 6 months now.
How did it start? Did it start all of a sudden or did it gradually start?
It started gradually.
Okay, and do you think it is becoming worse over time?
Yes, it is. It is getting bad over time. Initially, I could eat vegetables, fruits, rice, but now I can't even drink water properly.
I'm sorry to hear that. And could you please tell me where do you think the food is getting stuck? Is it getting stuck at the throat or do you feel it getting stuck down in the chest?
Not at the throat, doctor. The food is getting stuck around the chest area.
All right. And do you have any episodes of vomiting during this time?
Sometimes I have vomited after taking food.
Okay. And after how much time of taking food do you vomit out?
As far as I remember, it was like roughly around 30 minutes.
And do you ever see blood in the vomit?
No blood, as far as I know. I don't think I've seen blood in my vomit.
Do you have any pain in your throat or in your chest anywhere?
No, no, no pain.
Any heartburn?
No, no heartburn.
Okay. Do you feel any bad taste in your mouth?
No, not actually. No bad taste.
Okay. And do you hear any kind of gurgle sound in your throat?
No, no gurgle sound as well.
And how's your bowel habit? Is it all right?
Yep, bowel is all right.
Okay. And do you see any change in the color of your stool becoming darker or any change in the color of your stool?
No, I don't think I've seen any change in the color.
All right. How's your appetite?
Appetite is reducing with time. I don't feel like eating anything.
Okay. And do you feel like you have lost weight from before?
Yes, yes, I have lost weight. My clothes have become looser now.
Okay. And do you have any weakness anywhere in your body?
No, I don't feel weak even after losing appetite. I don't feel any kind of weakness.
Okay, I see. And do you see any kind of swelling anywhere in your neck? I,
No, no, no swelling around my neck.
all right. All right. Did you ever undergo any surgery in the past?
No, no surgery at all.
Do you take any medicines for any medical condition for which you have been diagnosed in the past?
Yes, I do. I have hypertension, so I take medicine for that.
Okay. Could you please tell me the name of the medicine?
I don't remember the name of the medicine at the top of my head now.
All right. It's okay. So, do you have any kind of allergies to anything?
No, no allergies at all.
Okay. And Could you please tell me what do you do for a living?
I'm a retired sales manager.
All right. And are you a smoker?
I used to smoke a lot.
Okay. And for how long have you been smoking?
I have been smoking for the past 20 years.
And how much would you smoke per day?
On an average, it would be like one packet a day.
All right. And do you drink alcohol?
That's only occasionally.
Okay. Did anybody in your family have similar problem?
Not a similar problem, but my grandfather died out of colon cancer.
I'm sorry to hear that. So what do you think this might be happening with you?
Doctor, I've talked about this problem with my friends as well, and I'm really scared. My friends tell me that at this age, this might be a cancer. What do you think, doctor? Is it a cancer?
This is too early to say that. We are going to, I need to examine you. We will do some test upon you. I'll talk to my consultant and definitely will find out what is wrong with you. What do you expect me to do for you?
I wanted to find what is wrong with me, and please help me out, doctor. I can't live with this anymore. This pain.
Definitely, I can totally understand your concerns. I can totally understand them. And we are going to find out what is wrong with you. We are definitely going to run investigations, and I'll talk to my consultant and get back to you. So, do you have any other questions for me?
No, doctor. Thank you so much for your consultation.
All right. Thank you so much. This was the 6 minute discussion with the patient. Now the examiner will start asking the questions. The first question the examiner will ask will be summarize the history. So the summary of the history will be a 70-year gentleman presented with complaint of difficulty in swallowing for last 6 months. It was gradually in onset and initially with solid foods, but now he's having dysphagia with liquids as well. There are few episodes of vomiting within 30 minutes of taking meal, though there is no history of any blood in the vomiters. There is also a history of loss of appetite and loss of weight. There is no history of pain, indigestion, or halitosis. There is also a history of hypertension for which he's taking medicines, and he's also a known smoker for 20 years, and he has a family history of colon cancer. So after the summary of the case, the next question will be, what is the provisional diagnosis? The most probable diagnosis for this patient will be carcinoma of esophagus. And what are the other differential diagnoses? The other differential diagnosis will be motility disorders of the esophagus like achalasia cardia, gastroesophageal reflux disease, esophagitis, any neck swelling like pharyngeal pouch or goiter, autoimmune diseases, and even neurological diseases like CVA may present with dysphagia. So the next question will be, how do you approach this patient, or what are the investigations you do for this patient? So I'll do a complete hemogram. I'll do a CBC, total blood count. I will do a chest X-ray PA view. I will confirm my diagnosis by an upper GI endoscopy and a biopsy from any suspicious lesion. I'll get a CT scan of the chest to stage the disease. If this is not a cancer, then I might have to do a manometry to rule out achalasia cardia or other motility disorders. The next question will be, how do you treat this patient? I will discuss the case in a multidisciplinary team and plan the treatment options. Since the patient is having dysphagia to both solid and liquid, the patient might require feeding jejunostomy or a feeding gastrostomy prior to the definitive treatment. The definitive treatment involves esophagectomy followed by reconstruction and chemoradiation. So that's how we approach the history taking station. If we prepare the differentials well, if we know the questions specific for each differential, we can finish the history taking station much before the allotted time. And that's how it becomes very scoring. Just be prepared, practice a lot. I'll be uploading more videos subsequently. So stay tuned to this channel. Subscribe to this channel if you like this video. Thank you.